Hello, volunteers for the 2026 Point in Time Count. Thank you so much for joining us today for the volunteer training video. I'm really excited to be working with all of you. We have a lot of returning volunteers this year. And so we're really excited to work with all of you to make the point in time count a success. And what we're going to do today is we're going to walk you through all of the things you'll need to be prepared going into the point in time count. We are going to kind of give a general overview of everything, what the point in time count is. Even though we have many returning volunteers, we do have a number of new folks as well. So welcome to all of you. Really glad you could join us as well. So once we do kind of a general overview of what the continuum of care or the COC is, we'll talk a little bit about the point in time count itself. And then we're going to go through the survey, talk through all the details you'll need for the day of. You'll be receiving all of your volunteer assignments as well as a link to this video. And then we'll have space available for questions for any folks. We are available here as staff to answer any questions and help make the point in time count a success and make sure everybody feels really comfortable going into that. So I will take a brief moment just to introduce myself and then we'll jump into everything. My name's Megan Samples. I'm the program coordinator for housing and community health here at the George Washington Regional Commission. And I'm in partnership with the director of our program here, Sam Shukas, and we help to staff the Fredericksburg Regional Continuum of Care. And so I'm helping in the planning process, and many of you received many emails from me before. And so let's go ahead and just jump into it. So background on the point in time count, like I said, we're going to kind of talk through all of these things and then we'll go through what to expect for the day of. So what is a continuum of care or what's better known as a COC? So many folks might be familiar, but the COC is a federally mandated network of organizations that's working together to prevent and end homelessness in a given region through a strategic planning process. And so what that means is we work on a coordinating level for the community and anything that touches homeless response system and homeless services. So, since COCs are federally mandated, there are a number of them throughout the state, as well as across the country. So, we are here, of course, in the Fredericksburg region. Our COC covers all the localities within the Planning District 16, which is the city of Fredericksburg, as well as the counties of Stafford, Spotsylvania, King George, and Caroline. As you can see on this map, there are a number of COCs across the state that work in very similar capacities. All of those little areas in that bright green color, you'll see labeled as balance of state. So the balance of state just helps to run and coordinate services through smaller local planning groups and is coordinated through the state office in Richmond, Virginia. And that just really is because there are some areas where there's, smaller population of folks experiencing homelessness. Areas might be more rural. They don't have quite the same capacity as a larger region like ours. And so the state wants to make sure that those areas are covered as well when it comes to coordination of services. So you'll see there's a number of other colors here. We do have the Charlottesville area, Lynchburg, Roanoke, Harrisonburg, Winchester, a lot in Northern Virginia, both Loudoun and Fairfax, Prince William, all the counties that you would imagine, as well as the Middle Peninsula and over on the eastern side of the state as well. So, what exactly is the COC? So, as I mentioned, we of course serve the Planning District 16 that many of you volunteers are living in currently. Our vision really is a compassionate and thriving community where all people have access to a place to call home. So, really, what this means is we are focused on our mission of preventing and ending homelessness. And the way that we do that is we develop, support, and promote a coordinated system of human services and housing opportunities in the greater Fredericksburg region. So really what that means is we help serve in a coordinating role and bring together all the amazing partners that are working on the homeless response system throughout the region. That can be anything from, direct service organizations that many of you will be familiar with that are providing direct housing, but then also any organization, local government, business, homelessness, individuals that are working with any folks who are experiencing homelessness or at risk of homelessness. And so we do have these core values listed here for you. We really try to focus on these throughout all of the work that we do. On the staff level, as I mentioned, Sam Shukis is our program director. And myself here, the program coordinator. And so we work for the George Washington Regional Commission, which serves as the lead agency for the COC. So what that means is at GWRC, we do a lot of local planning, not just in housing and community health, where Sam and I work, but also environmental services, local transportation planning, economic development. And so, because of the kind of wide-reaching nature of GWRC, about 15 years ago, GWRC was selected to be the lead agency for the COC and help serve in that coordinating role. So, as I mentioned, there are a number of organizations that are a part of the COC. Our COC has roughly 50 organizations that are active members. So, as I mentioned, Sam and I sit here on the GWRC, or the George Washington Regional Commission. We have our core housing providers that are offering direct housing services. And those are going to be organizations like Micah Ecumenical Ministries. We have Lois Ann's Hope House that works with homeless families. We have Empower House that supports survivors of domestic violence and provides housing for folks who are fleeing domestic violence. We have the Rappahannock Area Community Services Board, or the RACSB, and they work with folks who have serious mental illness and also are experiencing homelessness. We have FAHOS, or Fredericksburg Area Health and Support Services, that are working with folks who are experiencing homelessness who have HIV or AIDS, as well as providing a number of LGBTQ plus services. And then we have our veteran service organizations. We partner very closely with the Veterans Administration, as well as local service providers like Volunteers of America. You also have all of these other organizations that really come together to make the COC what it is. So that, as I, kind of mentioned before, this is going to be any organization that is touching folks who are experiencing homelessness in any way. So as you can see, we have active membership and partnership with all of the 5 localities in the planning district, all of the area social services, public schools. You also have organizations that are focused on healthcare, right? Mary Washington Healthcare, various healthcare organizations, and the health district. So anything that, is working on health, food insecurity, like the Fredericksburg Regional Food Bank, and organizations, even the Fredericksburg SPCA, working with folks who may have homeless companion animals. So it's really broad. All the organizations that are a part of the COC really come together and make our community response what it is. And that collaboration and that partnership is really at the core of what we do. So who do we serve? We serve folks who are experiencing literal homelessness. That means people who are sleeping outside, someone who's sleeping in a car, tent, or abandoned building, and sleeping in emergency shelter. We also serve folks who are at imminent risk of homelessness. So that's people who may be fleeing domestic violence, staying temporarily in a hotel or motel, or with family and friends, couch hopping, those types of situations. People who are exiting hospitals, jails, or other institutions, and then folks who may be experiencing the eviction process. And so this is not to say that organizations in the COC only serve this bucket of people. This really is just a core focus of our direct housing services. We, of course, are aware, and have many community conversations around all the folks that are on the margins of that as we begin to see that more and more. We do have a number of organizations throughout the COC that are COC members that work with folks who are staying in hotels or motels long term. Also, we have organizations that are serving children within the public school system under the McKinney-Vento Act who are experiencing homelessness. So the work of the organizations within the COC is very broad. Funding that comes through the COC, state and federal funds, are targeted towards individuals who are and families who are experiencing literal homelessness. That kind of fits this definition. So the point in time count tracks folks who are experiencing literal homelessness throughout the region. We, of course, are aware this is a point in time, hence the name. It is one night. We recognize this number like really fluctuates throughout the year depending on various factors. However, information kind of tracking the numbers and the population of people experiencing homelessness on one day, we keep it the same. It's always the last 10 days of January every year. And so we have quite a bit of data throughout the years where we can track roughly how many people we're seeing on average with the data that you all as volunteers are collecting. So as you can see here, this is the last 5 years of data broken down into different categories. And so you can see the total number of folks experiencing homelessness during the point in time count in January of 2025 were 189. We had 171 of those were in sheltered homelessness. So that means they're actively enrolled in a housing program or an emergency shelter. And then we identified 36 individuals who were outside, unsheltered. This kind of dark green bar on the bottom for chronic homelessness is for folks who have been outside long term. And so we track all of those numbers too. You can see the bottom chart is looking at the population numbers. That obviously, of course, is growing over time. And so we want to make sure that the number of folks experiencing homelessness that are engaging with services kind of meets that need. You can see we kind of have a steady number of folks who are experiencing homelessness in the region. It's stayed fairly steady throughout the last 5 years in particular. And so we track all this data to say, to ensure that we're really evaluating, are we seeing rises in numbers? Where are those folks located and all of that? So what is the point in time count? This is why you're all really here. The point in time count is a count of persons experiencing homelessness on a single night in January. And like we kind of discussed, that's really an opportunity for us as a community to collect information on anyone that is literally homeless per that HUD definition that we talked about, folks that are going to be outside and unsheltered. And so the objectives really are to help estimate those current rates of homelessness and track that progress over time, like we were talking about looking at that chart. It also, on a national level, helps HUD, which is the Housing and Urban Development agency, really assess what those national trends are. Are we seeing a rise over time? Are we seeing, folks experiencing homelessness in various areas, some more than others, right? We want to make sure that, we can use that data to fund programs and make sure that the community has the funding that it needs to meet the real need in the community. Those numbers also are used on a state level for state-funded programs as well. And also locally, it helps us identify if there are any holes, right? Because you're talking to folks who are experiencing homelessness themselves, and we want to make sure that their input, their experiences are centered in how we run our services in the community. So, what to expect the day of conducting the count? You're going to meet your team. Many of you will be meeting here at the GWRC office building, especially for early morning street teams. Once you're with your team and you get to, kind of talk through what the survey is and all of that, you're going to find and approach potential interviewees. You'll then conduct the survey and then you'll wrap up, bring everything back to the GWRC office building. And we really want to emphasize that safety and respect are the priority in every step of the point in time count. So each team will have one team leader and 2 to 3 volunteers. There are some teams that are going to be a little bit larger than that, but there will always be at least 2 people on a team. So team leaders are going to be checking in here at GWRC before traveling to service sites, and all volunteers will be checking in with their team leaders at their site. Instructions for this will be coming out once your team assignments are made and finalized. I'm really pleased to say that we have almost 70 volunteers this year. This is the most we've ever had, and we're really excited about that. What that means is we're going to be able to have an expanded reach of who we're able to find, especially out in the counties. We've always had a really strong presence in the downtown area in the city of Fredericksburg, but we've been working the last number of years to expand our reach and making sure we're being just as comprehensive in the other localities in the planning district. And so all volunteers won't always be meeting here before you go out. It will be specific to your team, and you will receive instructions of what that looks like, what to bring, what to wear. All of those things will be included ahead of you going out. So when you're approaching interviewees, there are two kind of separate buckets of teams that are going to be serving individuals. We have teams working at service sites throughout the community. And so those people are going to be interviewing people who are accessing services, mostly in the downtown area. And so they'll be connecting with folks who are entering and leaving buildings. We also have teams that will be focusing on our cold weather shelters, which is our seasonal, weather-dependent emergency shelter run by Micah Ecumenical Ministries. And so there are two sites for the cold weather shelter. We have a men's site and a women's site, and so we'll have teams at both of those. And then we'll have a number of field locations. So teams in the field will be approaching individuals who may appear to be homeless. Folks will be visiting encampment sites. And so it's really important, that you go about this like we talked about with respect and safety in mind, and that you're prepared going into it. So we'll talk a little bit about kind of approaching interviewees, a guide, especially in particular for field teams. Each team will always have somebody that is experienced on their team. So, like I said, we do have a number of new volunteers, and we're really excited about that. And we understand it can be kind of an intimidating process, certainly if you've never worked like in a human services field, to talk to strangers and ask them very personal questions, right, about their living situation and other points of data that we're going to talk through today that are included on the survey. And so we want to make sure people feel really comfortable going about that. There's, a number of kind of ways to start those conversations. And as we go through the training, we'll kind of talk through some of those things. So your first contact, you're going to want to really assess what situation the individual is in. If you are in an encampment, it's always important to announce yourself and wait to be invited in. If somebody is awake and in sight, you'll introduce yourself and offer to conduct the survey with them. And so there is like a little prompt here. You definitely don't have to use this word for word, but this little word prompt here can help kind of start that conversation. Really, the biggest thing is emphasizing that you're volunteers, you're hoping to improve housing programs and services throughout our community. This prompt is a little bit old, so it says we're giving bus tickets to people who speak with us. That is not specific to this count. We're not giving away bus tickets. We do, however, have incentive bags. And so folks, whether or not they choose to take the survey, you're welcome to provide incentive bags, and each team will be given those to their team leads. The survey takes about 10 minutes overall, and it's important to really emphasize to folks that this information is confidential. It is also de-identified, so you're not taking people's full names, you're only taking their initials if they're comfortable providing them, and that's really just so we make sure we're not duplicating, and that folks aren't, being surveyed more than once, so that we can get as accurate of an account as we can. If folks are asleep, it's really important, don't engage, right? If you find someone that is sleeping, please do not wake them up. We do have an observation form for those types of situations. You want to make sure that you're respectful. In encampments, even if people are awake and in sight, you want to ask if you can come in, announce yourself, wait to be invited, those types of things. Encampments are people's homes at the time that they're at in their life, and so it's really important that we treat those spaces with respect. So, this again is like kind of a prompt for how you can, begin that interview. It's really important to emphasize their participation is voluntary. They can choose to end the survey at any time. Again, they're Responses to questions are going to be confidential. They will not be shared with anyone outside of our team here at the COC. And if there are any questions that they're uncomfortable with or don't want to respond to, they do not have to answer. That does not mean that their survey doesn't count. If they don't answer questions or they don't know the answers to them, that's totally okay. We're going to talk through the survey, and it's important that we try to get as much accurate information as we can, but by no means is this a mandatory process. We want to be really respectful when we're engaging with folks and making sure that they're comfortable providing that information for us. So again, you're really wanting to gain the cooperation of respondents. So being friendly, confident, professional, using attentive body language, and giving clear and confident answers to questions. This is going to be really important. Of course, we've recognized these questions are very personal, and it takes some time, right, to kind of like prime yourself to have those types of conversations with people. So we really recommend you kind of practice through how you will be going about asking these questions to people. The most important part is that you're approaching every person that you're speaking to with respect and understanding that now especially is a very challenging time in homeless services, and folks may be apprehensive to answer questions. It's really important to emphasize to them that the information is confidential. So, some things that can be helpful with that and kind of gaining that buy-in and helping kind of build some trust with folks. Using verbiage like housing situation rather than homeless can be very helpful. Assuring that confidentiality, like we talked about, always using, respect to the person and the spaces that you're entering. And again, you're not here to force participation, to invade people's space, right? So it's really important also that we are not asking people's full names. We want to make sure that people feel really comfortable answering these questions. And so it's important to keep all those things in mind. So for conducting the survey, the goal really is to be complete and accurate with the information that you're obtaining. We, of course, recognize that you're not always going to be able to obtain all the information that's in the survey, but what is really important is that folks are really trying to obtain that as accurately as they can. Respecting respondent space, being active, engaged, and interested in what they're saying. Many folks who are experiencing homelessness do not have people asking them questions about their life and taking the time to talk with them. And so it can really be a cathartic experience for many people to sit and have someone just to talk to and share those experiences with. So it's important that you are engaged and interested in what they're saying. And then also, like we talked about, respondents definitely don't have to answer questions. And while we want information to be as accurate and as complete as possible, that by no means to, try to push someone into answering something that they're not comfortable with. Your team leaders will help you dispense the incentive bags when you're done with the interviews. Typically, we kind of break these up. Each team will receive a certain amount, and then if you need more supplies or materials, you can always pop back by the office if you're out in field teams. But we'll make sure that you have all the incentives and materials that you'll need to complete the surveys. So once you're kind of wrapping up and all your information, you really, again, it's really important, and we cannot emphasize this enough, that this information remains confidential. So we have paper surveys. We also have a online form for the survey. If you are doing the paper surveys, which a lot of folks prefer for the field teams, you may be in an area that doesn't have quite good service, things like that. Your team leader will be responsible for returning all your surveys back to us here at the GWC office. So some safety reminders. It's really important that no one like breaks off from the team. You're paired in teams very intentionally, and folks are paired with people who have experience conducting the point in time count with new volunteers to make sure that folks are comfortable. So you just always want to remain in sight of your team. Don't put yourself or your team at risk. For transportation, we do recommend kind of carpooling with your team